Okay, I'll do this part. So looking at I'm a huge fan of the self-massage stuff, and I think it's really neat when it comes to the fitness profession, how the fitness profession is cool because it looks to see what's working in other professions and brings it back in order to enhance the profession. This is one of those things. So it's really cool to see, this year the big trend has been the breathing stuff. So that's been incorporated. Last year's like the self-massage stuff or the foam rolling, and that's come in. So it's really neat. We need to see what comes in next year. When it comes to self-massage stuff, when you injure your back, everything tightens up. Like all the way from your foot all the way to the top of your head, muscles end up tightening up. Specifically, stuff around your pelvic area ends up tightening up. So we've done our initial steps when it comes to things, and now we'll kind of incorporate the self-massage stuff in order to help when it comes to that tension side of things. Relieving tension, getting tension without the muscle, and that's how I end up thinking about it when it comes to the foam rolling. Now, it would be best if, like the ultimate team, if I had to end up putting it together, would be like the GP is the funnel in order to take care of anything serious, and then you end up having someone that does like manual therapy, someone that does body work and massage therapy, and then someone does fitness. I think if you have that combo, that's the perfect combo. And how I look at massage is, it'd be great if we were all professional athletes and we had someone on staff, or the athletic therapist and massage therapist did massage as well on a daily basis. Not realistic. So how the self-massage is, it's very much like your dentist. You go see your dentist every 6 months or every couple months, get the big clean, and while you're waiting to go back to see the dentist, you're doing your flossing and you're doing your brushing. Your flossing and brushing is your self-massage. That's kind of helping when it comes to the maintenance side of things. So it helps with decreased tension. Key things to remember, you're in the movement, or I think I meant to say moment. So once again, it's this visualization side of things that you don't have the music blasting, you're not thinking about your ex-girlfriend, you're not thinking about what you're doing this weekend. You're thinking about what you're ending up doing. What muscle am I rolling? Am I looking at the breathing and blowing out that tension in order to relax that muscle, in order to get more benefit? The guarding thing, I kind of talked about that. You're not tightening things up. You want it to be painfully good, but you don't want that guarding because it kind of counteracts the benefit. And then visualizing the muscle relaxing. Now, like when I start someone off, I just roll. And then we go from the rolling, we go into more advanced techniques. That trigger point, hold, relax thing. Start off with, we just roll, as opposed to going to because I need them to buy into the benefit of just rolling. And if I start we're talking general population. Athletes know that they need to go to pain in order to succeed. But general pop, they don't want pain. And if I start doing trigger point stuff and having them bounce off the roof, then it's like, no, I don't want to do that. It's painful. So I can roll them to start off with, and then we can start going into more advanced techniques when it comes to rolling. So I got different things that work. Foam roller works great. 1 foot works perfect. 3 foot's great, but 1 foot you can get a lot of wool with. I like the hard med ball. I think you guys have them here. That works really good as the next level up. The 2-liter soda bottle or pop bottle work great. It can't be opened, because then that changes the intensity of the contraction. You don't go crazy with it, but use at your own risk as a disclaimer. I haven't had it blow up on me, and the worst thing that's going to happen is the thing's going to pop out and everything's going to be fine. What's up? Yeah. Okay. and what I recommend, don't use like Coca-Cola. Like use like club soda, or so if it does blow up, it's really just water. So that's an easy way of doing it. PVC piping works great, and then there's a whole bunch of commercial tools. So I'll end up using the foam rollers, and varying densities work great. And I like the med ball to kind of get in there more, and then you can go to hard ball to really make you jump. So areas that I'm kind of focusing in on, like calf, we kind of talked about this. Calf, like in a supine position, so rolling over the calf, kind of like what Jeff was saying, inch or two below the knee, I go like right to the top of the heel. I can end up getting them into like a sitting position as well. So if they are in back pain, if I get them sitting on something and have something a little bit lower than the chair, they can end up rolling their calf with that. So they're on the couch with whatever that thing that they put their legs on. Ottoman, is it ottoman? Okay, put a footrest, a footrest, and they can go through that way with a foam roller to work on the calf. Hamstring, lying down, going through the hamstring area, but then also sitting ends up working well as well to kind of work on that hamstring area. Looking at everything is in good alignment. When it comes to glute med, so looking at glute med, glute max is up and down. Glute med, if I put that hand in my pocket, it's kind of at that of an angle, and that's the angle that I'm rolling when it comes to glute med. So if you do that, if you do glute max, it might be, doesn't that feels nice, something like poking me in the butt. But then sometimes, a lot of times, people, if you go with that 45 along glute medius, they'll end up jumping, because a lot of times people build up tension there. That glute med's working crazy to stabilize them in the frontal plane. So that ends up working good. I can end up utilizing the wall to hit it as well. A ball ends up working well. So a ball of some sort. The medicine ball, light, firm, works well to hit the glute med area. Piriformis, so I can end up doing on the floor, or I can end up doing sitting. So I can use the roll to kind of hit piriformis in a sitting position, or I can end up using the ball. And I use the sitting and the wall options because some people just can't get on the floor. If you're in really bad back pain, you just can't get on the floor. A rectate spinate, so I can end up doing in supine, or I can end up doing on the wall as well. Thoracic down to the pelvis. And when it comes to foam rolling, I like going right to the top of the pelvis, where a lot of stuff ends up hooking up, or like Jeff talked, the zone of convergence. I find that ends up working great, as opposed to just the belly. And then quadratus lumborum, I can end up doing supine and the wall. And it's tough when it comes to the foam roller to hit quadratus lumborum, but I find a ball works good to hit quadratus lumborum. And then you can also, on the wall, utilize a ball and kind of lean into quadratus lumborum.
Question about the foam roller.
Yeah.
I took a rolling course at a seminar one time, and they were saying that you should never roll through the lumbar spine just because of the frame design. So are you just saying left or right of the vertebrae, or are you actually...
I go right up and down. In supine, it's challenging to do because your trunk's over it, but on the wall, it's fine to do. From here and up, just rolling on the wall. So you can end up finding what tolerance that they can end up doing.
If you go to the side, you always have your elbow
And it's a big part. It's going to depend on what the client is. So like the wall, I like in order to kind of provide feedback. The foam roller provides feedback. There's tension in that rectate spinate group, and you can end up using like the cues of like, I'm going to get you to put your hands on your back, and I want you to kind of bend forward. How does your rectate spinate feel? Feels crazy. Okay, how if I arch back? It feels relaxed. Well, I want that relaxed going on. And then I can get them on the wall, and I'm giving you some feedback with that foam roller to give you a cueing to kind of relax those muscles. And then I can integrate the breathing to help with that. And then on the floor, it's more aggressive because more of the trunk is over. Yeah. And they end up having to, if they have to end up maintaining that lumbar spine in neutral, if you see it give way or go, then you're discontinuing the exercise. All research backing it up. So this came out like, I think, a month ago. So in conclusion, an acute bout of SMR, and we can call this whatever we want, of the quadricep was an effective treatment to acutely enhance knee joint range of motion without concomitant deficit in muscle performance. So utilizing the foam roller ended up helping improve range of motion without compromising performance. So that was cool. That's good. It's good to see that there's research coming out with this. And then looking at the massage benefit, so it's difficult to see that this kind of correlates when it comes to the self-massage stuff, but it does end up showing that if we're making this ultimate back relief pizza for the person, one of the ingredients that we can end up utilizing is that massage. So massage might be beneficial for patients with subacute and chronic nonspecific low back pain, especially when combined with exercises and education. And a lot of this, teaching stuff is educating them on their body, on how their body works and how their muscles work. When it comes to the stretching side of things, so I incorporate the stretching as well, because I find it ends up benefiting. And now, with the stretching, am I changing the length of the muscle for the long term? Probably not. I'm probably having an acute effect when it relates to the stretching side of things. So I'm helping when it comes to the tension side of things, as opposed to changing the resting length of the muscle over the long term. Hopefully that makes sense. So looking at it when it comes to addressing tension, helping when it comes to addressing that guarding, that I'll do the stretching side of things. I mean, calf, soleus, hamstring, piriformis, psoas, iliacus, and latissimus dorsi. Nothing crazy. I mean, regular calf stretch, soleus stretch, hamstring stretch. I can just, kick, leg straight, bending at the waist. Piriformis, just doing like a figure 4 stretch. Psoas kind of focuses more on the side bend. Iliacus is more of the traditional. So if I end up going into this 90-90 position and coming through, I'm kind of working more on iliacus. And if I add a side bend, I can end up feeling it more like psoas. Now you got to see if they can handle that side bend. So I end up hitting both of them. And then latissimus dorsi. And with the latissimus dorsi, a lot of times I'll end up like the side bending. I can get them in a sitting position and just getting them to reach to the side. So the movement's happening here. It's not lumbar. I'm reaching to the side and looking at stretching lats. And then what I can end up doing is I can end up doing unloaded, so like supine, or I can get them to do it in standing, which is loaded. So if I get them more in an unloaded position, it's going to be more effective as opposed to being in like a standard loaded position. But with a standard loaded position, if that's the only time they can do it, well, it's better that they do it than they don't do it. Does that make sense? So yoga classes, so the stretchings were more effective than a self-care book. So they just gave people just a book on back pain, but not more effective than stretching class, so like a stretching routine, in improving function and reducing symptoms due to chronic low back pain with benefits lasting at least several months. So adding stretching to our back relief pizza helps out.